Hi, Miss Karen. It's Jolene Biorn. This is my cardiac and respiratory assessment. This is Brianna, my patient. And I'm just going to scan the room and let you know that there's nobody else in here. It's a desktop, so it's kind of hard. But there's nobody in here. All right. So first thing I would do is walk in, introduce myself, check the armband, make sure it's the patient's correct identification, ask her for her name and date of birth. And also, if I was going to give any meds or anything like that, I would scan her armband. And then I would wash my hands for good patient safety. Okay, Miss Brianna, my name is Jolene. I'll be your nurse today. I'm going to do a cardiac assessment and a respiratory assessment on you, okay? All right. So first thing, I'm going to check her carotid arteries for a pulse to make sure they're good. Make sure there's no jugular vein distension. You feel good? All right, and then I'm going to go through each valve, listen to her valves, and then I'm going to get her apical pulse. Okay, so first I'm going to check the aortic valve. The pulmonic valve. That one sounds good. Okay, I'm going to go down to her tricuspid. That's mid-clavicular, halfway down. I'm going to listen to the tricuspid valve. Okay. And her apical pulse, I'm going to check her apical pulse here, and I have a timer over there on the computer to watch. Her beats per minute are 69, which is between 60 and 100, so she's fine. I'd ask her if she has any chest pain. Do you have any chest pain, Miss Brianna? No. Are you feeling okay today? Okay. And then I would do respiratory assessment. Okay. So the first thing for respiratory assessment, I would ask if she's having any shortness of breath. I would check her nail beds to make sure that she's getting all her blood back to her body and her everything is oxygenated. I would check for jugular vein distension, again, because it's respiratory, right? That's respiratory. It's good. I would check for all of her pulses. We've got her carotid pulses right in here. We've got the temporal pulses right in here. We've got the aortic pulses right in here. Brachial pulses right in here. The popliteal is underneath her knee. Radial pulses is right here on the inside of her wrist. We have the dorsalis pedis is on top of her foot. And the tibia dorsalis is underneath, posterior dorsalis is underneath in the back of her foot. Posterior is back. And then also her femoral artery, which is right in your hip, right here. All right, so I'm going to listen to her respiratory. She has no shortness of breath, nothing out of the ordinary. And there's 5 on front and 9 on back. I'm going to warm it up. Just rub it on. Can you breathe normally for me, please? Go right underneath your breast. Everything seems to be okay. And then we're going to do the posterior, which is in our back. And if she'd have a gown on, it'd be a little bit easier to hear and a little bit easier to see. Just gonna listen while she breathes. Take a deep breath for me. Okay, everything seems to be good. That is my cardiac and my respiratory assessment. Thank you.
Hope that didn't stop.